Hello friends, let us continue our class on HCV, hepatitis C virus. I'm sorry the last class has been interrupted by because of decreased charging of my phone. So right now I have dealt with the HCV. HCV DNA cannot be integrated with the host genome. So what happens to HCV? How does it enter the hepatocyte? If this is the hepatocyte, to this hepatocyte there is a receptor which is non-liver specific CD81 receptor, and there is another protein which is liver specific tight junction protein which is called as claudin. So through this, with these things, the virus hepatitis C enters into the cytoplasm of hepatocyte. So it enters into the cytoplasm of hepatocyte with these receptors. One is non-liver specific CD81 receptor, and also liver specific tight junction protein claudin. Via these proteins and receptor, it enters into the hepatocyte. And once it enters into the hepatocyte, it rely on the lipoprotein lipases, low density lipoprotein, that is low LDL cholesterol. It relies on LDL cholesterol pathway, and also HCV masquerades. It relies on LDL pathway, and it forms an HCV masquerades has a lipoprotein. Okay, so because of this lipoprotein, it does not be visible to the adaptive immune system. So adaptive immune system cannot catch it. So because it cannot catch it, so the organism will escape from immune clearance and autophagy. So this is the way how it survives from the survives by not even it not even be recognized by the lymphocytes. Okay, so majorly there are 6 major genotypes are there for HCV, and there are more than 50 subtypes in each genotype. In each genotype there are more than 50 subtypes. Okay, so these subtypes have many differences. Okay, this intra-genotypic differences, even they belong to the same genotype, they have differences among themselves. So this intra-genotypic differences is called as quasi-species. Okay, so this is one. And then because of this quasi-species diversity of HCV, so because of this diversity of HCV, they have high mutation rate. So even because of this high mutation rate, this will interfere with effective humoral immunity. So this will interfere with basically immune memory. So HCV, if reinfected with different isolates, different virus isolate, though it belongs to same genotype, but if it belongs to different serotype, in such cases there is no induction of last immunity. The last immunity, which it has memory B cells, they don't attack this new virus, though it is a HCV infection. So there is no homologous or heterologous. So no homologous and heterologous immunity appears after HCV infection. Okay, so that is one thing. And then right now, how do you detect the acute infection? So for detecting acute infection, we have third generation immunoassays. So these third generation immunoassays, this will incorporate proteins from core, that is mainly NS3 and NS5 regions. Thus it detects anti-HCV antibody for acute infection. This can be detected, and the most sensitive indicator, if you really wanted to know which is the best indicator, so most sensitive indicator is the presence of HCV RNA. This is detected by PCR or transcription mediated amplification. So this is detected by PCR or transcription mediated amplification. So this HCV RNA can be detected within few days of exposure to HCV, and even before appearance of anti-HCV antibody. Okay, so but the main problem here is if there is chronic HCV infection, the HCV RNA is detected only intermittently, not continuously. Okay. So replicative HCV in the lymphocytes of infected person can be detected by sensitive molecular probes. Okay, so this is about HCV, hepatitis C viral DNA. So let us learn about the next and the final infection of hepatitis, that is hepatitis E virus. So this hepatitis E virus, it is an epidemic. Previously it is labeled as epidemic or enterically transmitted non-A and non-B virus. So it is not a virus, not a B virus, and it is transmitted through oral route. It is around 32 to 34 nanometers, non-enveloped, HAV-like virus, and it has 7,600 nucleotide single-stranded positive sense RNA genome. Okay, HEV has mainly 3 genes or open reading frames. So they include ORF1, ORF2, ORF3. ORF codes for non-structural proteins. These are involved in viral replication. Okay, ORF2 has it encodes for nucleocapsid protein. 2 minutes. Nucleocapsid protein. It is a major non-structural protein. So it codes for nucleocapsid protein, which is a major non-structural protein. Now ORF3 is the smallest, and it codes for a protein which is undetermined. So undetermined protein. Okay, so these are the 3 types of open reading frames which are available for HEV. Now HEV has 1 serotype and 5 genotypes, and among these 5 genotypes only 4 are in humans. Okay, so genotypes, if you see, as I have said, it is 4. 1, 2, 3, 4. Genotype 1 and 2 are more virulent and it produces clinical infection, whereas genotype 3 and 4 are non-virulent and it only produces subclinical infection. So this will belong to Hepivirus genus and a family which is Hepiviridae. It is detected in stool, right? And then IgM anti-HEV and IgG anti-HEV are detected. Okay, both these fall after acute infection within 9 to 12 months. Okay, so this is about HEV infection. So thank you guys for watching my lecture. If you have any doubts, please comment it in the comment section. If you feel something is inadequate in this lecture, even then comment it in the comment section. Please subscribe this channel for more videos. In my next class, I will explain about the pathogenesis of hepatitis virus. Thank you for watching my lecture. Thank you.